Hello and welcome to Gateways to Healing. I'm Scott McGuffey, clinical hypnotherapist and your host. Gateways to Healing is a program where we look at how you can utilize complementary medicine with Western medical services. In this series of programs, we look at how you can introduce the 4 gateways to healing: mind, body, spirit, and community. Today I'm excited because we're going to look at what we put into our bodies and how that affects our health through nutrition, herbal supplements and remedies, and also natural paths of healing such as homeopathy. To help me do that today are my guests from Integrated Healing Arts, and on my right is Deborah Olenev. Thank you for being here today, Deborah. She is a certified classical homeopath who has been in private practice in Menlo Park and Palo Alto since 1992. She treats men, women, and children of all ages for a full range of health problems. Deborah is a graduate of Barnard College in New York City. And also with us is Christine Roche. She is a nutritional consultant, biofeedback therapist, and a clinical hypnotherapist. Chris has spent 20 years helping individuals and groups achieve optimal physical and emotional health. She has worked at the Heart Disease Prevention Program at Stanford, where she also holds a BA in Behavioral Psychology, and she also has a Master's in Public Health from San Jose State University. Thanks for being with us today, Chris. And back with us again is Jim Much. Pleasure to see you again. He is a registered pharmacist who has spent 30 years in the pharmaceutical industry developing new drugs. 3 years ago, he left that profession to pursue a more holistic approach to health. As part of his current practice, which includes Reiki, massage, zero balancing, and process-oriented acupressure, he advises his clients on herbs and other natural and nutritional supplements to help them in achieving health of the body, the mind, and the spirit. Well, pleasure to have all of you here with us today as we talk about these wonderful topics. Now, we've all seen in the past 10 decades quite a bit of a change, actually kind of a dramatic change in our belief system on nutrition and natural healing. It seems that the basic food pyramid changes almost yearly, and now herbal supplements are becoming a multi-billion-dollar industry. Well, as we look at those changes, what I'd like to do is start off with just looking at how nutrition, herbal treatments, and other natural treatments such as homeopathy have come into play. Chris, why don't we start with you? How has our view of nutrition changed over the years?
Scott, as you know, there's a much greater awareness right now on the effects of food, how food affects our emotions, and also how we respond to different stress situations. For one thing, the food pyramid, the classic pyramid, has changed dramatically into now much more awareness on an increase in vegetables and fruits and, fresh foods as opposed to the meat, dairy, just the standard 4 food groups. There's much more of an emphasis now on living foods and even, having people be aware of the effects of that. The combinations have changed quite a bit. So you can see
and what
that.
are some of those effects? What are people noticing that is changing in their bodies as they change their nutrition?
Well, what happens a lot of times is, as we look back at our ancestors of thousands of years ago, we really were meant to eat mostly protein and vegetables and grains and nuts and seeds as we were, hunters and gatherers and going through the years. So the whole packaged processed food that we're eating so much of right now in the fast food industry with very high processed fats and oils, which actually damage our heart and our immune system, is relatively new actually to most people, and yet it's so easy and convenient. So what happens a lot of the time is that people end up, just for convenience sake, eating foods that actually damage their cardiovascular system or can lead to long-term chronic disease and degenerative diseases. Because interestingly enough, those diseases were not around at that time, thousands of years ago. People were dying from warfare and from other things, but it's interesting that this is very recent. All of the chronic and degenerative diseases are very much linked to the packaged, processed, and fast foods that we're now consuming for the sake of, the fast pace and making it easy and convenient.
Yeah, for convenience sake.
Yeah.
And Deborah, I see you kind of nodding your head yes over here. What are some of the changes that we've seen in healing remedies?
Okay. I want to pick up on something that Chris was saying about how the health of the population has changed from even 200 years ago, 100 years ago. It is true that we're seeing much more chronic diseases than we were seeing before, and autoimmune diseases than we were seeing before. People used to die of acute illnesses or fevers. but much less so nowadays. Nowadays, people are dying more from cancer and leukemia. And I think definitely our food, what we're eating is affecting that, but I think it goes beyond that. I think lifestyle is also a big part of that change. We were living in an automobile culture. We're living in a culture where everybody has to be aware of time. We're wearing watches. These kinds of social influences also very much affect the health of the population. Also the medicine. We're using antibiotics now and vaccines, and there is evidence that these things have contributed to the lowering of the general health of the population. And homeopathy, what I practice, has some things that can address this. We use remedies that come from the animal, mineral, and vegetable kingdom, natural substances, to help to basically tune people, and it works with the immune system rather than against the immune system. So they're non-suppressive, they're healing agents.
Great, we've touched on quite a bit there, and I just want to go over to Jim here real quick, and I think we're going to come back to some of what you've just led into. But let's just ask you, Jim, with you were a pharmacist, right, and I assume that you were creating synthetic drugs, antibiotics, and so on and so forth. What is the deal with herbs these days? It seems like even now some of the pharmaceutical companies are producing herbal supplements and such. What do you see as the big change there?
Yeah, it's. I think it's really interesting how I think people have always wanted to take control of their own health, you know, and they have, but over the years they have kind of given that over to physicians, you know, and you know they've taken the approach, I can do anything to my body and the physician will fix it. And today, with the increasing costs of health care, people are looking more to how can I take care of myself, and along comes herbs and other nutritional supplements, and they now have the opportunity to do that. And I think people really want to do that and have really leaped at the opportunity to take on this responsibility for themselves.
Let me just ask you, when you work with your clients, how do you work? You do so much. I mean, you do Reiki, zero balancing now. How do you work the herbs into your practice with your clients, and what are some of the benefits that you see happening with the change? Yeah,
well, people will come to me with certain disorders, and I'll usually be doing some sort of body work or Reiki with them. We inevitably get into a discussion of nutrition, and I think that, you know, that one of the main things that I really like to emphasize to people in a real basis was what Chris already mentioned, is the whole fat story, and getting people involved in taking essential fatty acids that 90% of our population is missing. There's a real easy test that you can take to see whether you are deficient. All you need to do is take your fingernail and scratch your skin, and if you leave a white mark, you're deficient in omega-3 fatty acids. And these are readily available from things that we used to take. People used to have flax oil delivered to their doorsteps every day in Europe, but we've really gone away from that. So the going out and getting flaxseed or flax oil, and we can get into a discussion later if we have time, but this is sort of the basis of getting essential fatty acids back into your body and fixing so many of the things or preventing so many of the things that Chris was talking about, the degenerative diseases, cancer, arthritis. These sorts of things have all been really linked to deficiencies in these substances.
So what is, I can kind of see a problem happening, and I know that I certainly did it for a while, is that in this fast-paced society that we live in, certainly here in Silicon Valley, I think everyone would agree, it can be quite tremendous, just the pressure to get from point A to point B, let alone carry on business. But I want to get back into the lifestyle thing, which now all three of you have mentioned, and working with like the convenience factor versus just the natural path of health into what we put into our bodies. And Chris, you also work with people who have compulsive eating disorders and sugar addictions. I mean, that's got to be one of the biggest problems that most of us have in the society, you know, immediate energy. how does someone find balance then?
What happens a lot of times is that with the sugar addiction is that, it'll start out by eating, for example, chocolates and cakes and candies, and many times also people are not aware that by eating the carbohydrates like the breads and the pastas, those are also converted into sugar. So people will say, oh, I'm just eating a few candies a day, and yet I constantly have this feeling like I'm eating a lot of sugar. And so what happens is that, once a person becomes addicted to that, then their thinking changes. They have a hard time actually making decisions often.
So you mean an
Very
actual
fatigued.
physiological change occurs that impedes their thinking process?
That's right. Their concentration and also their energy level dramatically. And sometimes they'll have mood swings. And what's most interesting is that if sugar and insulin is very high in the body, it's equivalent to having much more of the stress hormone circulating. So that it's very much like they're under constant stress. And here they're already under a lot of stress. So every time, for example, that they consume a Diet Coke, it's interesting, you think, oh great, it's diet, right? And yet what it has in it, the NutraSweet, is equivalent to a couple of tablespoons of sugar. It actually makes them crave sugar even more, and they actually gain weight from the diet sodas.
Meanwhile, it sounds like whether it just seems so complicated yet so simple in that they're wanting to have more energy.
Yes.
So they're eating the carbohydrates and the sugars, but on the other hand, they're just driving themselves into the ground. Deborah?
Yeah.
It's interesting, in homeopathy, the way I look at food is a little bit different from the way Chris does. What we do is we regard the foods that people want to eat as guides to the medicine that they need. So for example, if somebody craves salami, we have about 4 or 5 remedies that crave salami. So that would be that would help to guide to the remedy that they need. And if somebody doesn't like fruit, we have a lot of remedies where they don't like fruit. And then if they're craving chocolate, let's say they're craving chocolate and don't want fruit. That would be 2 things that could link together to help me see what remedy they need. So I don't really do too much nutritional counseling or telling people what to eat, because I'm looking at the language of the body and seeing what they want to eat, and using that to help guide me to the medicine that they need. It's like a signpost. I want chocolate and soda pop, and that's we have maybe 4 or 5 medicines that want that combination of foods. So
how does that work then? Go ahead, Jim.
Well, I wanted to pick up on the sugar thing, because
it seems to be a big thing.
It is such an important part of this whole thing that is going on. The body doesn't recognize sugar as being a nutritional substance. And as soon as it hits the bloodstream, it looks at it as a toxic substance, and it immediately converts it to the thing that everybody is trying to eliminate from their diet, cholesterol. In fact, it converts it to low-density lipoprotein, and it gets stored as fat. So here you are on this fat-free diet. You've gotten off all of the beef or whatever that is providing all the cholesterol, but you continue to eat something that has a lot of sugar in it, and your cholesterol doesn't go down, and you say, what's going on? And the problem is that you're actually feeding yourself the cholesterol in the form of sugar. So if you want to get your cholesterol down and you're worried about it in your diet, you got to get the sugar out.
And it's important too to be aware of the simple sugars versus the complex, because many times when a person eats an apple, for example, it takes so much longer to go into their system that even though it's sugar, it's a much slower, and it's a natural food. So in that case, that would not impact the body, would impact the body in a positive way, as opposed to,
So an apple
sugar.
or a piece of fruit would be a complex
That
sugar.
would be a complex sugar versus a simple sugar, which would be, coming from the white sugar, white flour products, which includes all the white pastas as well, and the white rice, by the way.
Yeah. So as we look at this, we can start to see what the problem is. I mean, I can see it quite clearly, is that we have created a society that is, in essence, we're putting pressure on ourselves. So, I'll just stop by the local fast food place on the way home, pick up dinner for the wife and the kids, and away we go. But let's look at more specifically, how do people bring this into balance? To change society, we have to start with inner change. As Jim mentioned, people are desiring to begin to heal and to be a part of that healing experience. So what are some of the things that people can do to add balance in that? Where can the individual begin the first step? Deborah?
Well, I do believe that to go from being to being a ill person to becoming a healthy person is a transformation. It's a physical transformation, it's an emotional transformation, and a spiritual transformation. You can't carry your sick habits into your new healthy body and way of being. So I do a lot of teaching because, for example, your emotions have to be made more healthy. So if you are feeling very jealous or very angry, that's an obstacle to cure. So I do teach or suggest to people to try to practice some meditation. And then also, overworking is an obstacle to cure because you're not in balance. So I do suggest to people who are working 10, 14-hour days to cut down. But unfortunately, in our society and the demands of Silicon Valley, not just Silicon Valley, it's the entire United States, we are, in a sense, kind of forced into living unhealthy lives. And it really is a challenge to us to try to break away or to rebel against what society is asking us to do. And I feel like now we're going into the 21st century, we're actually losing ground rather than gaining ground, because the 8-hour workday that we had, that our ancestors or people 50 years ago were fighting for, is now gone. It's a dream of the past, you know. I personally think that a 6-hour workday makes a lot more sense. You know, that's at that level you can have time to go home and cook a decent meal for your family. But so the needs of the individual are not being met by the society, and I think that the standard of health of people in the society is dropping. So I don't really feel like that our society is successful. You know, maybe we're monetarily successful, but I think in terms of meeting the needs of the people, we are failing miserably. Okay.
Well, I think that, you know, we would love to see people make these tremendous shifts in their lifestyle, and yet it really is impossible, given the way this society is, for people to do that. And if they can just start with a few things, you know, drinking more water. You know, we all are, I mean, if you were to, I've heard recently that there's a pyramid that has water at the bottom now instead of anything else.
Yeah.
Because, you know, 8 glasses a day, it's, you know, as we get older, if we don't drink enough water, our brains shrink. And, you know, I think that some of the old age dementia is related to this shrinking. If you don't feel well, you go take a glass of water or drink a glass of water and you suddenly feel better. You know, so, I mean, just drinking more water is one step along the way. Another step is, you know, getting more exercise, looking for organic foods. I mean, these things are easy. I mean, everybody's in the grocery store looking for food. Look for the organic label instead of just going and finding something that isn't organic. So many things are loaded with pesticides that, you know, that we store in our fat, and well, we know where we got the fat. But anyway, it's just, these are little things that we can do that will really help us along the way. But you got to remember, it's got to start from within you. You know, you can't go, you can no longer accept the paradigm that I will be fixed when I can do whatever I want to, and somebody's going to fix me. You really need to take responsibility for your own health, and that's where it all starts.
Yeah, Chris?
I take people, you know, on tours of some of the larger natural food stores, and I found that we can find some really easy to use substitutions. So for example, instead of people who say, you know, I don't have time, is I take them to places where they can find healthy, you know, proteins, vegetables, grains that are already prepared for them, know what to look for. It's very quick and easy. I teach them how to prepare those foods in less time. And I also use biofeedback as a way of helping them access the stress patterns. So many people with the compulsive overeating that I work with have patterns where they're eating because of stress. And so if they can identify where the stress is and let it go, And we can do that over time in about 5 minutes or less. You know, if they can learn how to do that at their workplace, then they're actually able to know the cues much better. In other words, now they're eating because they're hungry as opposed to because they're stressed or fatigued or
looking for
some
the
other
sugar,
reasons.
the sugar
Yeah,
craving.
as a way of fixing it, you know. So in other words, my clients go from being really out of balance and so much tension that they're running around trying to find, you know, food is a way of relief from that, like you were saying, to being much more balanced, you know, releasing the tension, feeling like the biofeedback is a tool for them to go inside and check in with themselves every day. Practical stress management.
Well, you know, that's interesting because that's something that we've hit on every program in Gateways to Healing, is that once again it comes back and that the 4 gateways, the mind, the body, the spirit, and the community, are all just a gateway, and then as we enter into the gateway, a lot of these other things come into play. Let's just talk a little bit about how what you do, you know, with nutrition, homeopathy, herbal supplements, and the other body work that you do, Jim. How does that play in with Western medicine? I mean, Jim, you're telling us that, which I completely agree with, you know, we can't look at the fix-it mode anymore. But how does what you people do work with Western medicine? How can we see the complement there? Deborah?
Well, I think homeopathy has a lot to offer for chronic health problems that Western medicine actually is weak in. So, so people who have chronic headaches or any chronic problem, homeopathy is, in my opinion, a better way to go. It's very efficient. 1 dose of a remedy can last 9 months to a year. It actually, we don't treat the disease, we treat the person, and our goal is to restore balance to that person by finding an energy that matches their energy. It's like a vibration. Homeopathy also has a lot to offer for just to back up Western medicine. For example, in surgery, we have many remedies that can be taken before and after surgery just to hasten the healing process. For example, arnica reduces swelling, trauma, things like that. We have a remedy called Staphysagria, which we call the surgeon's friend, and that reduces pain in the site of the incision. We have hypericum, or St. John's wort, which is very good for injuries to areas rich in nerves, which can be used post-surgically. So I think it would be wonderful if homeopathy and Western medicine could get it together in this country. In other countries, they kind of have got it together more. Like in England, homeopaths and Western and allopaths, we call them, work simultaneously in the hospital together on the same patient, and they respect one another.
Great.
So.
Yeah, I hope that happens soon.
Yeah.
Certainly see the benefits. And Chris, what about nutrition? I mean, we've got a lot of Western doctors out there. One that just comes to mind is Dr. Dean Ornish, who's written his fabulous books on nutrition and heart disease and such.
Yes.
So what is the support that you can give there with complementing Western medicine?
I work with a number of physicians, you know, as a complement, doing patient education for them, helping them to really, for their patients, especially many times the physician, you know, has not taken the time to really train in this area. And so what they will say is that they really appreciate the fact that for the diabetic or for people, you know, with the cholesterol, with the heart disease, that there is a way that I can educate them and also teach them ways to change their habits. You know, most physicians, as you know, have very few time, especially in managed care, to really spend with the patient. So it's a complement, and there are some physicians I work with who are actually trained in nutritional medicine, who will, you know, do a lot of the laboratory tests and who will really work with the patient in that area and who still want someone to carry out the lifestyle changes.
Sure.
So it's a really important complement, and it's becoming more so in the next couple of years, I think.
Yeah.
Yeah.
And Jim, how do you see herbal supplements and remedies working with Western medicine?
Well, in the easiest way to think of it is using herbal medicines as substitutes for allopathic medicines. And you know, St. John's wort is a very good example of something that is not only has a homeopathic application, but has a more of an allopathic application in mild depression, mild to moderate depression, and it's been studied extensively in that. Ginkgo biloba is another one that is used a lot, and it's good for peripheral vascular disease. It can help memory. And then there are the antioxidants such as milk thistle, which or silymarin, which is really very specific for the liver. So that's a very simple way to look at it. But you know, I think that herbs and nutrition can contribute to, in a much broader sense, in a more holistic approach, which also incorporates the body work that we've talked about. You know, where which I think the body work, zero balancing, massage, acupressure, these things all really fit in very well with what Western medicine is doing. You know, some people grow up getting a massage as a child every day or, you know, every week, and these are incredibly well-adjusted people. Zero balancing. We were talking. I was just at a class this weekend, and we were talking about how some mothers will do a 3-minute ZB on their child before they send them off to class every day, and they end up just being so much more balanced. Zero balancing is just is sort of a structural acupressure, and it's just a wonderful way of balancing body and structure, or body and energy. So these are some of the ways that I see that we can work together.
Well, good. I want to thank you all. We're coming down to a close here, but we certainly have touched on a lot of different things here, and I hope that the viewers out there will take a little bit of attention to that, to what they eat and how they eat it, and also to look at homeopathy and how that can bridge the gap with Western medicine. And for right now, I'd like to thank my guests, Deborah Olenev, certified classical homeopath, my mind just went back, and Christine Roche, who's a nutritional counselor, biofeedback therapist, and clinical hypnotherapist, and Jim Much, who is a wonderful individual working with zero balancing, craniosacral therapy, and herbs. And with that, what I'd like to do is thank you for being with us here today, and just want to take a few moments that we would like to hear from you. We invite you to share with us which programs have been beneficial to you, or if you have a topic that you would like to see discussed on Gateways to Healing in the future, if you could please give us a call and leave a message at the MPAC Feedback voicemail, and that number is 650-494-8686. And as we look into the future, as the change of the 21st century comes on, we would like you to just take a moment and reflect on your eating habits and other natural remedies, and to also investigate that self-healing process as you go in with mind, body, spirit, and community.